Ebola. Introduction. Ebola can cause severe bleeding and organ failure in the body. Select true or false. Correct. Ebola is a hemorrhagic fever. Hemorrhagic fever prevents the blood from clotting normally. It can also damage the walls of blood vessels, making them leak. A person who is infected with Ebola usually isn't contagious until they develop symptoms of the virus. Select true or false. Correct. Symptoms of Ebola can happen within 2 to 21 days after a person comes into contact with the virus. People can become infected with Ebola if they come into contact with the body fluids of an infected animal or human. Select true or false. Correct. Ebola can spread through a person's blood, saliva, semen, or vaginal fluids. Treatment for Ebola usually includes giving the patient extra fluids and oxygen. Select true or false. Correct. Treatment may also include a blood transfusion to replace lost blood. Which of the following can help prevent infection? Choose one of the following options. 1. Washing your hands often. 2. Wearing a mask. 3. Covering wounds on the skin with bandages. 4. All of the above. Correct. Avoid traveling to places where there is a known outbreak of Ebola. If you are already in an area where there are known cases of Ebola, avoid contact with people who may be infected. Infected people should be isolated. Thank you for using Explain.